Me through your study, because your study in 2024 specifically looked at this connection.
Absolutely. So in Sweden, we have the unique opportunity to connect all of the health records for the entire population. And during antenatal visits in Sweden, the mothers self-report their consumption, and we can also track prescription data. And then we can follow the children through time. And doing this, we were able to amass 2.5 million pregnancies in Sweden, which we could then compare for the risk of these outcomes. And what we do see in the beginning is a slightly increased risk. However, as soon as you start to account for the maternal health conditions, the reason the drug is used, and other familial factors, the risk disappears.
Right, I'm looking at those numbers right now. Autism, 0.09% higher. Other things, ADHD, 0.2% higher, a couple other things there. Is that enough for anyone to rationally say, look, see, there is a link?
Definitely not. And when we proceed to compare siblings, which is one of the main strengths of our study, so we compare where in one pregnancy the mother used the medication, in another pregnancy she did not, and we're able to control for all of the underlying genetics and the household environment that remains stable, even these small signals disappear completely. So this is not something I would be concerned about.
Hmm. You said 2.5 million people results. I just want to get you on the record to say that is not a small base to base your results on.
No, it is the world's largest study on this topic. There has been other similar large-scale efforts from Japan since our study was published. There has also been some large-scale studies from Norway, but this is the largest of its kind.
If you could speak to President Trump right now, one on one, what would you say?
You've misunderstood the evidence. Please talk to the experts instead.
If he says, I have experts, I have RFK, I have the CDC at his control. What's your response to that? Because that's something he potentially would say.
I would want to know why they chose to ignore the large-scale studies in favor of smaller studies, and why they choose to believe some of the narrative but not the other.